Hi everyone. As promised, I'm getting you up some better quality videos, especially in the realm of the imagery. These will be much better because I already have the voice layover on YouTube already of the chapter 11. I'm going to breeze through these really quickly because this is more about you guys being able to see what's on the screen. I am going to talk about things that I think are vitally important. Of course, as I've always say, everything's important, but that I think that's really important that I want you guys to make sure you take a look at. Guys, remember what I said. For you to be successful in this class and in future classes you'll be taking, such as ALHT 211 in phlebotomy, when you sit for your registry exam, when you're out doing clinicals, which is not only a learning experience, but a time for you to be on a long-term job interview, as well as when you go out to go to work. You want to have all the knowledge that you can to be able to do your job as efficiently and effectively as you can. As I know you are all seeing now from watching the news, this feels like a war. And instead of fighting something that we can see, another country, other people, sadly, we're fighting a virus that you can't see without a microscope. And instead of it being the Army and the Air Force and the Navy, it's healthcare workers that are on the front lines every day risking their lives to save people. You guys are one of those healthcare workers. That's why I tell you the job you do is vitally important. You're a professional. And I want to make sure I instill in you the importance of your job and the job that you do every day. Right now, there's phlebotomists all over this country going into rooms of patients with COVID-19, drawing their blood and doing their job to save the lives of these patients. That's why when I teach you about, and I know y'all get tired of it sometimes because it seems like I go over the same thing over and over again, but as you walk into your lab and I say, what do we do every day? We get the bleach and we clean our area, right? We check and make sure we have all the supplies we need. We wash our hands, we don our gloves and our PPE. And I'm sure every day you guys are saying, yeah, I know that. I've been taught that when you watch that on the news. How important that personal protective equipment is, how important it is to clean off your surfaces before you bring a patient in and after that patient leaves. And I hope this really hits home the point to you guys, how important this really is and how important the job that you will be doing is. So we're going to go through these slides really, really quickly. You're only going to hear my voice for high points, and then I'm going to upload these so you guys can get a better look at them and start filling out your study guides. As always, if you need anything, please reach out to me, okay? If you're having technical issues that you need help with, anything, literally, guys, I'm here for you. I want you to reach out to me. We're going to be successful. We're going to get through this, okay? So those were our learning objectives, and like I said, you can pause this video at any time and make sure that you are able to read through this stuff. Take the time, okay? So on this slide, the things I want to point out to you are benefits, right? And the main one, and there's a whole list of them that I want you to read, but anemia, that's the main thing you want to look at. If a person is anemic, on the verge of being anemic or severely anemic, we don't want to add to that issue by causing the problem to be worse. Also, patients see this as being less painful, okay? So make sure you read through each one of these slides carefully and fill out your study guide. Okay, so indications for skin puncture. These pictures are horrifying, I know, but these are some of the things that as your frontline healthcare workers out there, you will see. So things we want to take in mind is that when we want to draw the smallest amount of blood anytime we're doing either a skin puncture or a venipuncture, we always want to be very mindful of getting the least amount of tubes, the least amount of blood as humanly possible. But the thing we want to remember is neonates, infants, and children, their blood volume is less. We want to be really careful with those. And also patients who are obese. Sometimes a skin puncture will help us strictly because If they have a really large layer of fat on top of their skin, it may be very difficult for us to find that vein and be able to get blood from from veins, but we could from a skin puncture. Also keep in mind that that's why we have a little bit longer of a needle, 1.5 inches instead of 1 inch, for patients that are obese that we may need to use that needle for. But make sure you read through the rest of these indications. So reasons why we may not can use skin puncture. Okay, we want to make sure that there's ways and reasons why we would want to go to a skin puncture, and then there's things that tell us that we can't go to a skin puncture. And one of the things is if this is a transplant patient or some other serious illness where we need large amounts of blood, lots of tests are being done on this patient, consequently we will not be able to go to skin puncture. Also, looking down here at specific tests for which skin puncture is not recommended, especially blood cultures. We would never ever do a skin puncture for blood cultures. Coagulation studies, most of the time we would never do that. There are some instances where there are some capillary tests that we can do a PT on for monitoring of patients, but that's usually just in a monitoring type situation, and we do have some calculations and the doctor would need to know about this so he could make adjustments. And we have our study tip down at the bottom because you need to memorize these. Put these to memory so that when you're out in the field working, you will know the tests that are not recommended for skin puncture. Here's our case study. I'm not going to read this. You have time to pause this, and I do suggest that you take out a piece of paper, pause it, read it, answer it, make sure that you're putting this stuff together so that you're learning it. So when you take your test, you will know that you have all this information. And not just that, not just so that you can do well on your test and do well on your registry, but that you know that you are understanding this information and being able to put it together so that when you're out there taking care of patients, you know that you can critically think through these scenarios that you're going to come in contact with. And at any time during this slide, if you say to yourself, you know, I don't get it. I don't know what I'm missing. I'm getting these case studies wrong. What part am I missing? Please, please, please reach out to me. Send me an email. Tell me what's going on. I will call you on the phone. I will email you back. I will put up an additional video. I will do whatever I need to do to make sure you guys are being able to put all these puzzle pieces together so that you'll be the best phlebotomist you can be. So composition of capillary blood, we've talked about this before. The main thing I want you to take away from, you need to understand what the arterioles, the venules, the capillaries, the intercellular and interstitial tissue fluid, what all that is. But you also need to understand that skin puncture blood is more like arterial blood. That's the takeaway. And that because it's mixed composition of both capillary, of both venous and arterial blood, but it leans more to arterial, you're going to look at lower values of potassium, total protein, and calcium, and higher values of your glucose. And also that you always want to note on your requisition form whether it's venous or capillary blood. That's why we do this every single day in lab. What's our specimen source? And it's on our requisition because it's vitally important that we let our physician know that. So a 4-year-old was admitted to Willis-Knighton South. Read through this case study. Okay, this deals with a 4-year-old. Make sure you read through this case study carefully and answer it. So skin puncture sites. We remember that it's the fleshy central palmar surface of the distal phalanges, the fingertips of the 3rd and 4th finger of the non-dominant hand. Remember, we want it to be off-centered, okay? We remember why we don't choose certain fingers having to do with calloused areas of the fingers that are calloused because they touch a lot of surface all the time, and going out our way to try to avoid puncturing the bone, okay? And we also remember that if they're 1-year-old or younger, neonates, and they're not walking, we would do the plantar surface of the heel, either the lateral or the medial side, because we don't go the center of the heel as well, but for the same reason, we do not want to pierce or puncture a bone. So these are some areas that you would not want to puncture. And remember, guys, look to your textbook. There is a lot of great pictures and information in your textbook that will really, really help you when doing this. Another case study. Again, please, guys, do this. This will really help you when you're out there working. It will make you be the best healthcare worker you can be. Pause this video, take out a piece of paper, and really see if you're getting these case studies right. And remember, we have case studies that you should be working on. I know that you haven't turned that second case study in yet that would have been turned in already, but keep working on those case studies too. Take advantage of the time you have. I know some of you still are working. I know a lot of you have your children home and it makes it more difficult for you, but really take the time to start working on those case studies you have at home as well. And I will get with you soon on turning those in. But don't panic. I'm going to give you extra time and we're going to work through this, but start working on this. Okay, improving your site selection. This is just a slide that talks about the things that you can do to make sure that you're having the best blood flow to that finger as humanly possible. Because remember, it's 7 times more blood if you warm it. There's lots of products out there to help you be able to warm those fingers. Okay, we have heel warmers. I'm sure you guys have been at stores and seen those hand warmers that they sell. That's very similar to the commercially available heel warmers that we have in doctors' offices and hospitals. You can also get heated surgical towels or washcloths. You can put very warm water in a glove and tie it up and get your patient to hold it. Whatever you need to do to get that site area, whether it's the heel or the finger, warm will help you. Also, lowering that arm down and getting that blood flow down to that site. Here's another case study. We know and cleaning the puncture site is vitally important, and we know that no more better than we know right now, dealing with this pandemic, of how serious it is not to clean surfaces, not to wash your hands, and when you're about to take a lancet or a needle and puncture through somebody's skin to their blood, we do not want to spread bacteria. So we always want to make sure we clean our puncture site with concentric circles using 70% isopropyl alcohol and allow it to dry, because we know we have germs in our mouth, right? And we don't want to take the germs from our mouth and put it back on the area we just cleaned. Okay, so make sure you look at failure of alcohol to dry, what it can cause, okay? And make sure you look at why we don't recommend using iodine as a way to clean skin punctures. And it can falsely elevate things like potassium, phosphorus, and uric acid. So here's one of our critical thinking slides. These slides are in here and we use them in a classroom because what I'm trying to get you guys to do is take all the information that you're learning from these slides, that you're learning from your textbook, and that you put it all together, and when you're out there, you will know what to do. So moving on from here, we're talking about acquiring a capillary blood specimen using a retractable safety device, okay? So on these slides, you see we talked about not air drying it. We've already talked about that. We also know from other classes and from lab that we wipe away that first drop of blood and that blood smears should be made first. We invert gently our micro container 20 times to mix our blood with our additive, whether that's some type of silica that helps speed up the process or whether it's one of our different anticoagulants. Okay, we also know that that blood will flow into that device or tube or cassette or whatever it may be by capillary attraction or capillary action. And we know that we do not scoop up the blood. We don't scrape it across there. That could cause hemolysis. But you just touch the tube, the little scoop, to the big drop of blood, and then it will, due to capillary action and attraction, it will go down into that tube. We talked about these things, and we also talked about when filling capillary tubes, you do not allow air bubbles to enter the tube. This will give us erroneous results. And we talked about in lab about wicking our capillary tube on our desk protector to get that, if you have blood, then air bubble, and then blood, to get that first bit of blood out, which we hate to waste, but we've got to get it out to get the second set of blood specimen down to the end of that capillary tube so we can start filling it again. Okay, we always want to make sure we ensure bleeding has stopped before we apply any bandage. And remember, children have a tendency to put their fingers in their mouth. They can even grab their leg and put their foot in their mouth. So we want to make sure that we don't put those band-aids on those small children. Okay, we also make sure we need to know what the average depth of skin puncture should be for an adult, which is 2 to 3 millimeters, and less than 2 millimeters for a small child and infant to avoid injuring that bone. Okay, we also want to make sure we seal our capillary tubes on the end. If not, the blood during centrifugation will fly out the bottom of it and make a mess. Okay, we also know that we label immediately at the patient's bedside before leaving the room. Remember, guys, this is all part of properly IDing our patient and make sure that we get the right specimen on the right patient. Okay, we never label anything before we stick a patient. Okay, never. And we always make sure we label immediately after we draw our blood. Okay, repeatedly puncturing the bone can lead to osteomyelitis, which is an infection of the bone. Okay, and then order of filling microcollection tubes, which is different than our venipuncture, right? The very first one that we always fill first is our EDTA specimen for hematology, okay, which is our purple top, right? But we would always make our blood smears first, then fill our EDTA or purple micro container. Then any other micro container that has additives in it would go next, and then non-additive tubes like the red. Again, read over these case studies. Make sure you're working on your case studies at home from your binder. I will get with you soon about the changes on due dates for those case studies and how would be best to get them to me. Okay, we talked about this. Like I said, you can always refer back to the other videos I did with a bunch of talking on it if you need to. Otherwise, if you feel comfortable reading these slides and filling in your study guides and get it studying immediately, read your chapter 11 in your textbook. But the thing you need to know from this slide is your microhematocrit talks about your packed cell volume, and that your capillary tubes have heparin in them, which we know is an anticoagulant. They should be 2 to 3 2/3 of the way full, and they should have sealant at the end of each one. Okay, we remember that we use EDTA on our hematology specimens. Other than this, and as people say, well, that's kind of confusing. Well, the microhematocrit test does not look at cell morphology. We're looking at the volume of packed cells. Okay, now in other hematology specimens, we're looking at cells. So the heparin distorts cell morphology, so that's why we do not use it for our other hematology tests. So making blood smears, and like I said, guys, look on page, let's see, it starts on page 388, goes over to page 389 in your textbook, and it goes over this blood smear, making and using your blood smear, okay? So read over this and look at those pages 388 and 389 in your textbook. Remember the spreader slide should be in front of your drop of blood. And as you can see from this slide right here, as it starts to run across that slide, when you bring it back and touch it right here, see how it's running across that slide? It's running out. That's when you know that it's time to, as these arrows show you, it is time to move that slide forward. You don't want to push down real hard. Okay, you want it to be at that correct angle. If not, you'll have issues dealing with that. Also, you want to make sure that it covers about half the slide, that it has a nice feathered edge at the end with no ridges, holes, or lines, and it goes from a very thick blood smear to a thin blood smear, okay? And you never want to blow them dry, Okay, so now we're moving on to doing blood pH and blood gas determinations by skin puncture. So again, we always want to warm our site, right? Because this will mainly be done with children. And once you draw the blood into the collection device, which is a Nadelson tube, then what you're going to do, and it looks a lot like a micro container, but it's much larger. And I know you guys have seen that in the lab. I showed them to you. They're a little bit bigger and a little bit longer, and they have that little metal wire that we call a flea. And then when the blood's in there, you insert the flea in there, you have it sealed, and then you take a magnet and you move that metal flea back and forth to mix the blood with the anticoagulant. So we want to talk about hemolysis, right? And here we know that hemolysis can be caused by when we're drawing blood, and these are the things that if you do them, they very well could cause hemolysis, which we want to avoid because it can give us some erroneous lab results. So here's one of our critical thinking slides. So again, guys, please take the time to pause these and just make sure you're getting this stuff, that you know you're learning it and it's making sense to you. And again, if you have any issues where you just don't feel like you're getting this stuff together, please email me and let me know. Remember, in vivo means it's happening inside your body. Something is going on inside your body, and in vitro means it happened outside of the body, which would be something that we as healthcare professionals did to cause it. So I'm not going to read in summary of these chapters, but you guys know, so I'm going to post these. I'm going to post the rest of them. Take the time to read through these. Please, guys, read your chapters, fill out your study guides. I'm going to get with you soon on what the date will be for our next test. Please don't panic and look soon. We're going to talk about case studies, and we're going to talk about things that we need to do in lab. We are hoping that no one will have to take an I in lab. So if you stay on top of doing the small things that I'm going to have you do that's going to count towards your lab grade and your lab test, and what we will be able to do is hopefully we'll be able to get back into the classroom at some time, finish up whatever we need to do in lab so that you guys can smoothly transition as before. So hang in there. If you have any questions, comments, or current concerns, please reach out to me. Thanks, guys. Have a great day.